The distinction between medical information and medical advice is legally and ethically significant, but often blurred in AI health interactions. Understanding this difference and ensuring AI respects it is crucial for both user safety and appropriate liability allocation. Medical information is general, educational content about health topics. It explains what diseases are, how body systems work, what symptoms typically indicate, what treatment options exist for conditions, and general health principles. Providing medical information doesn't require knowing anything about the specific person receiving it. A brochure about diabetes management is medical information. An anatomy textbook is medical information. General explanations of what chest pain could indicate are medical information. Medical advice, in contrast, is personalized recommendations about what a specific individual should do regarding their health. It requires knowing relevant details about that person, their symptoms, medical history, current medications, risk factors, and circumstances. Telling someone whether they should go to the emergency room, whether they should take a particular medication, or what treatment approach they should pursue is medical advice. This distinction matters because providing medical advice requires licensure and creates legal responsibilities and potential liability. AI systems typically claim they're providing information, not advice, as legal protection. Terms of service explicitly state that AI isn't providing medical advice and shouldn't be relied upon for medical decisions. These disclaimers attempt to prevent liability for bad outcomes while still allowing AI to discuss health topics. But the actual user experience often blurs this distinction. When someone describes their symptoms and asks what they should do, and AI responds with recommendations, this feels like and functions as advice even if disclaimers say otherwise. The problem is that people seeking health guidance need advice, not just information. Knowing that chest pain could indicate heart attack, muscle strain, anxiety, or acid reflux is information. Knowing what you specifically should do about your chest pain right now is advice. AI that provides only information without helping people translate it into appropriate action is limited in usefulness. AI that provides personalized recommendations crosses into advice territory regardless of disclaimers. Interfaces need to clearly label outputs to help users understand what they're receiving. When AI provides general health information, this should be explicitly stated. This is general educational information about condition. It's not specific advice for your situation. When AI starts making recommendations based on users' described symptoms or circumstances, this should trigger warnings. I'm not a doctor and this isn't medical advice. You should consult a healthcare provider for personalized medical advice. Presenting uncertainty explicitly is part of responsible information provision. Rather than stating possibilities with equal weight, AI should indicate probability and confidence levels when possible. While many conditions could potentially cause these symptoms, the most likely explanations in a healthy adult with no risk factors are common benign causes. Less common but more serious possibilities include serious conditions, which typically also involve other symptoms. This probabilistic framing provides information while helping users understand likelihood. For any action-oriented advice, human verification should be required rather than AI operating autonomously. If someone asks whether they should go to the emergency room, AI should not independently make this determination. Instead, it could provide information helping users think through the decision while explicitly recommending they call a nurse advice line, contact their provider, or err on the side of caution by seeking evaluation. Escalating to human triage for high-stakes questions maintains safety while allowing AI to handle lower-stakes information requests. Distinguishing symptoms requiring urgent evaluation from those suitable for watchful waiting is inherently advice, not just information. AI that makes these distinctions is practicing a form of medical triage. This should be acknowledged rather than obscured by legal disclaimers. If AI is going to provide triage-level guidance, it should be held to appropriate standards and subject to oversight, not permitted to operate in a regulatory gray zone. The information versus advice distinction becomes particularly strained when AI provides treatment suggestions. Explaining that various medications exist for a condition is information. Suggesting which medication might be most appropriate for someone based on their described situation is advice. Some AI interactions carefully maintain information framing. Treatment options for this condition include medications A, B, and C, which work in different ways. Your doctor can help determine which is most appropriate for your specific situation. Other interactions slide into advice. Based on what you've described, medication B might be a good option for you. Regulatory frameworks need to address this gray zone directly. Either AI systems providing health guidance should be regulated as medical devices subject to safety and efficacy requirements, or there should be clear limitations on what AI can say and do without being considered medical advice. The current situation, where AI provides what functions as medical advice while disclaiming its advice, serves neither user safety nor regulatory clarity. Patient advocacy organizations should educate people about these distinctions and about the limitations of AI health guidance. Understanding that AI provides general information that requires professional interpretation for individual application helps users engage with AI tools more appropriately. Knowing when human professional advice is truly necessary versus when AI information is sufficient for self-care decisions is an important health literacy skill in the AI age. Healthcare providers should address this directly with patients. Rather than being frustrated by patients bringing AI-generated information and questions, providers can acknowledge the distinction. AI can provide good general information about conditions and treatments, but it can't give you personalized medical advice because it doesn't really know you, can't examine you, and can't take full responsibility for your care. Let's talk about how this information applies specifically to your situation. The fundamental principle is that medical information and medical advice serve different functions and carry different responsibilities. AI excels at providing information and struggles with individualized advice. Designing AI systems that acknowledge this distinction clearly, rather than exploiting ambiguity for legal protection while providing de facto advice, would better serve both user safety and honest interface design. Users deserve to understand what they're receiving and when they genuinely need human professional advice rather than algorithmic information.